Hello, and welcome to your simulation appointment at the Mount Sinai Hospital, Department of Radiation Oncology. Today, we'll be walking you through the steps involved in your simulation and your daily treatments. Before your first treatment, we will ask you to answer a few questions on this tablet. Your answers to these questions will help to personalize your experience, and we'll work with you to manage any anxiety you may have about your treatments. Today is your simulation appointment. The simulation appointment is the planning stage for treatment. The purpose of this visit is to find and pinpoint the exact area we will be treating. The first thing we do is introduce you to your simulation therapists. They may ask you to drink a bottle of liquid called oral contrast. The drink is berry flavored and has a bit of a thick texture. This liquid allows us to better see your internal anatomy on the CT scan and therefore plan your treatment. It is important that you do not use the restroom from this point until the end of your simulation appointment. Please let us know if you find this difficult so that we can try to find ways to make the process more comfortable for you. Having a full bladder will help to move the small intestines and other organs up and out of the pelvis area. This will help to move them away from the radiation treatment area. Your simulation therapist will meet with you and go over the procedure for the day and answer any questions or concerns that you may have. Then you will go to the changing area where you will undress from the waist down and put on a gown. Your gown should be worn open to the back. Many patients choose to wear two gowns, one open in the front and another open in the back. This may help you feel less exposed and more comfortable during your appointment. Once you've changed, we'll bring you to the simulation room. You've probably had CT scans done before. A simulation is very similar. The bore, or donut that you will pass through, is much larger than that of a regular CT scanner and is open on both sides. How you are positioned during the simulation process is very important. Depending on your specific treatment plan, we will ask you to either lie face up or face down on the treatment table. You may or may not be asked to open your legs slightly. We may make a custom mold for you called an alpha cradle. Lying in the mold will help to ensure that you are in the identical position each time that you get your treatment. Once the mold is complete, your doctor will put a small sticker on your anus or penis depending on where we are treating. Having these body parts touched or exposed can feel uncomfortable. Nothing invasive will happen and nothing will be inserted internally. For male patients, there is one more step. We'll ask you to adjust your penis to make sure it's pointing down towards your feet. This helps move it out of the way of the radiation treatment field. Your therapist will do an initial scan to confirm you are positioned properly. You can breathe normally and relax in whatever way is best for you when the scan begins. For example, some people choose to listen to music to distract themselves. Although we won't be in the room with you during the scan, please know that we are right outside. We are listening to you through the intercoms and will come in at any point you need us. During the scans, your doctor and therapist work together to pinpoint the area of focus for your treatments. Your therapist will then come in and draw a few marks on your skin with a regular magic marker. Your therapist will photograph your position, including the marks they made on your skin. They are placed confidentially in your treatment chart. After the photos are taken, we will give you tiny tattoo dots on top of those marks. The tattoo dots are permanent, but they are no bigger than a freckle. These tattoos will allow us to position your body accurately every day for your treatments. We will make approximately 4 tattoos, 2 on either side of your buttocks and 2 on your lower back if you're lying face down, or on your belly if you're lying face up. Once the CT scan, photos, and tattoos are complete, you can get up and go to the bathroom. Your simulation is over. Overall, from start to finish, you can expect to be in the radiation clinic today for approximately 1 hour and 30 minutes. We know that it can be uncomfortable to have a full bladder, especially if you're lying face down on your stomach. If you are worried about this, please talk to us. We are here to support you throughout your appointment. Over the next few days, we will work to make your personal treatment plan. It is checked by your whole team, including your physicist, radiation oncologist, and the radiation therapist. Your first treatment day is usually 1 week after your simulation appointment. Your daily treatment is very similar to your simulation, other than the fact that you will not have to drink any contrast. When you arrive, you will go to the bathroom to urinate. Then you will drink the measured amount of water. You will wait approximately 45 minutes for the water to fill up your bladder. Once your bladder is full and you have changed into your gown or gowns, your therapist will walk you into the treatment room. your therapist will help you get into the same position that you were in for your simulation appointment. You will lie in the custom mold made for you. If you are lying face down on your stomach, your gown will be opened in the back, exposing your backside and buttocks so that your care team can see the tattoos and your treatment area. Your therapist may dim the lights in the treatment room so they can see the lasers. They will use lasers to make sure you are in the correct position, using the tattoo marks on your skin to help guide them. For some patients, as part of their treatment, we will use something called a bolus. A bolus is a soft rubber-like material that your radiation therapist places over your anus. This helps your healthcare team ensure that you are receiving the correct amount of radiation. For many patients, this setup can feel strange, or they may feel uncomfortably exposed. Your radiation therapist will make sure that you are uncovered only when necessary. Once you are set up, the treatment team will leave the room, but they are right outside. We will be working on the computers to deliver your treatment and can hear you through an intercom system and see you on a monitor. If you are uncomfortable, speak to your radiation therapist. They can turn off the machine and come in to see you at any time. The time spent on the table in the radiation treatment room is about 15 minutes. Your total time in the clinic for treatment is around 1 hour and 15 minutes. Thank you for taking the time to watch this video. We hope that you feel prepared for and understand the process of radiation treatment. Now we'll be asking you a few questions about how we can personalize your experience and help manage any anxiety you might have. Thank you again, and remember we're here to support you every step of the way.